Hello folks, welcome to the Fitness for 55 Plus podcast brought to you by Stronger Life. My name is Dr. Dustin Jones, physical therapist and co-founder of Stronger Life, and today we're going to be talking about diabetes, type 2 diabetes in particular, and how you can reverse it. So we've had enough folks here at Stronger Life, the gym for 55 Plus here in Lexington, Kentucky, that have reversed their diabetes, that have gotten off their medications, that have gotten to that normal A1C level, and want to talk about some of the things that we've witnessed, what we've observed, and some really helpful things that you can do, whether you have a diabetes diagnosis or you want to make sure you don't get a diabetes diagnosis. Now, before we get into this, I want to give kind of an overarching kind of picture of diabetes just so we're on the same page. So there's two different types. What I'm going to be mainly talking about is type 2 diabetes. All right, type 1 is kind of a whole beast, a different, all different thing compared to type 2. So type 2, how we want to think about this is, let's say I am maybe living in a way, eating in a way where my blood sugar levels are consistently high, they're consistently elevated. That can have negative implications on the body. When my blood sugar levels are high, my pancreas does its job and releases insulin. That insulin helps get that blood sugar out of the bloodstream and put it to work in various different ways. And if we're consistently asking a lot of our pancreas, of having to put out a lot of insulin, we have elevated blood sugar levels over long periods of time, months, years, decades, that whole system starts to kind of wear out and become less effective. And there's negative implications of that because the end result is that blood sugar is circulating through that bloodstream more than what we would want, and there's a lot of negative implications associated with that. And usually when we get the diagnosis of diabetes, we're going to get a medication that's going to help lower those blood sugar levels, maybe help out the pancreas, the insulin system as well, so on and so forth. Now, in terms of getting the diagnosis, typically you're going to get an A1C level. So they'll take your blood and they will look at your A1C level, which is basically your average kind of blood sugar level over the past 2 to 3 months. And there's some ranges, all right? So if you get that A1C level and it's below 5.7 or 5.7%, then you're considered to be normal. If you're that 5.7 to 6.4 range, you're considered pre-diabetic. Sometimes you'll get an intervention like a medication, but a lot of times it's, you need to move more, you need to eat a certain way. And then 6.5 or above is, diabetes, and you'll definitely have some type of medical intervention most of the time. A drug like metformin, for example, some type of medication that's going to help lower those blood sugar levels, all right? So what we've seen at Stronger Life is we have a lot of folks that have gotten off their medications, that have taken their A1C levels that were north of 6.5 down below, 5.7 into that normal range. And there are some really potent things that you all can do to make sure you don't get diabetes, but then also even reverse it. The first one, the most obvious one, is nutrition. And I'm not going to spend a lot of time here because there's so much stuff on the internet about what to eat, what not to eat. The overarching theme is you typically don't want to consume a lot of foods that are going to elevate your blood sugar really quickly. Those are called high glycemic foods. Obviously like candy and soda, juices, those types of things are going to elevate it. But even something like rice, for example, like white bread, some of those types of things can elevate your blood sugar level in a relatively short period of time, as opposed to, let's say, like a potato. That's going to elevate your blood sugar level because it has a lot of carbohydrates, for example, but it does it over a longer period of time. So those high glycemic foods, they spike your blood sugar relatively quickly. Those typically are you probably want to avoid those, not all the time, but most of the time. This became very apparent to me when I wore a continuous glucose monitor, or a CGM. If you may have seen one, you'll see it on people on the back of their arm. It'll be kind of this white disc, and it has a sticker on it, but then also a little needle, and you just put it in the back of your arm. It doesn't hurt, you don't even feel it, and it's transmitting blood sugar levels to your phone, and you can see how your blood sugar levels respond to certain foods, and that was very eye-opening for me to see. But that's nutrition. You all hear all about that. We're not going to spend much time there. I want to spend more time on the movement piece. because I feel like it's one of the more neglected interventions around diabetes. That's probably one of the most important interventions. When we move, our muscles are asking for blood sugar. They want to use some of that sugar in our bloodstream for energy, and it is very effective to lower those blood sugar levels when we move and exercise. And I want to cover just some very simple things that you can do to ensure that you have those consistently low blood sugar levels. One is consistently exercising. Not just exercising once a week, couple times a week, but we're talking 3, 4, 5 days a week where we're consistently moving. You are going to consistently use that blood sugar that is circulating in that bloodstream. And you're going to have so many other benefits as well, but the consistency of the exercise is really, really helpful in terms of managing blood sugar levels. But then what we often see is people start to exercise more frequently and consistently. They put a higher price or higher value on what they eat, because you really start to realize and feel, man, if I fuel my body appropriately and eat really good whole foods, I stay away from the junk that's going to, spike my blood sugar, so on and so forth. That helps me feel better when I'm working out. It aids in my recovery. It helps me lift heavier. It helps me move faster. The more people work out, typically the more they value and prioritize their nutrition. And so it really has kind of this compounding effect related to diabetes and so many other things. So the first thing is the consistency of the exercise. The second thing is the timing of the exercise. And this is probably the biggest ROI you can get in terms of how much effort you have to give and how much you get out of it. Whenever you eat a meal, for example, any meal, you'll have that initial blood sugar spike. So your body is taking that food, you break it down, it's releasing those sugars into your bloodstream, and it'll vary based on what you eat, but you have that kind of spike. If you start to move right after you eat, it blunts that spike. So it will dramatically reduce that spike and kind of stretch it out, if you will, which is really, really good for your body, for your pancreas, and so many things. And so even the simple act of walking for 10 to 15 minutes after you eat can be an absolute game changer. I saw this with the CGM that I mentioned before, is that when I would walk after I eat, even if it was, like a full plate of spaghetti and then a cookie or two, it would blunt that response and be similar to like a healthier meal that I would have, earlier in the day, because I was using my muscles and it was reducing that blood sugar. It doesn't have to be strenuous. That was a cool thing. It could be a very casual walk with a pet, spouse, partner, yourself, whatever, 10 to 15 minutes after you eat, and that can significantly influence those blood sugar levels. And what we see is when people exercise consistently, when they may exercise or move after they eat, when they become more mindful of the things they eat so they aren't spiking their blood sugars, your A1C levels will start to go down, and the medications that you may be on now or have been on, you are able to remove them. You don't have to depend on those medications to regulate your blood sugar. And then after several months, and we've had folks in about a 6-month period reverse their diabetes. You can be all off that stuff and have a normal A1C level. It's pretty remarkable. The body's absolutely amazing, and when you give it the things it needs, it can improve and heal itself and ultimately get healthier. So that's what I have to say about type 2 diabetes. Consistency of exercise, and then the timing of the exercise. I want you to really focus on that. And if you have any questions about type 2 diabetes, feel free to drop it in our Fitness for 55 Plus Facebook group. So that's where we post all of these podcasts. We generate all of our questions. We have some amazing discussions. It's just a group of folks just like you, over 55, that want to live the best life that they can, and they want solid advice, and we're going to be in there to provide that. So I thank you all for watching, listening, wherever you consume this podcast.